Hi, good afternoon, everybody. My name is Dr. Mugisha Kyaruzi. I'm a cardiovascular surgeon specialist working at a university hospital and private institution. Today, I would like to talk about the heart diseases and everything about these type of valves that we have in our heart and how they function and how they affect our health and what are the precautions to be taken when we get these type of diseases and how we treat these type of diseases and how do we follow up to patients who have the heart valve diseases. So the heart valve disease is these are diseases which affect the heart, and they might be divided into four types. There are those diseases which are congenital. Sometimes the people are born with the heart valve problems. These are congenital heart valve diseases, and there are those which are acquired heart valve diseases. These acquired heart valve diseases include rheumatic fevers, rheumatic disease, rheumatic heart valve diseases are the diseases which are affecting the heart valves due to rheumatic problems. And also we have degenerative heart valve diseases, which is due to age. As we get older, our also valves are also affected in many ways. We have four valves in our heart. We have two valves on the right heart and two valves on the left heart. The two valves on the right heart includes the tricuspid valve and pulmonary valve, and the other two valves in the right heart in the left heart includes the mitral valve and aortic valve. These valves they allow the flow of the blood in one direction and prevent the flow of the blood in the opposite direction. So when the valves becomes affected, they become either leak or they become very narrow or stenotic. So when these valve diseases become narrowed, most of the time they need to be replaced with the other type of valves that are found in the market. And also when the valves become leak, they either have to be replaced, but in most cases we prefer to preserve the valves by repairing them. So the most common type of the heart valve disease that we see is the mitral disease, and most of it is due to degeneration, and the other factor in less developed nation or developing countries, it is due to the rheumatic fever. So when the people they suffer of rheumatic fever during the childhood, and when it is not treated without taking antibiotic, in later times it affects the valves. It affects the valves in the heart, and in the future, when the patient get older, you find that these valves are either affected in one way or another. So the most common valve disease that we see, as I've told you, it is the mitral valve. And in most cases, in developed nations where we find that this degeneration of the mitral valve, we try to repair it by using different types of techniques that we have right now. And also, we do have the valve diseases whereby instead of being leaky, it become very, very stenotic. And most of the time, apart from degeneration, it might be due to the rheumatic diseases whereby you find these structures which are anchoring the valve, the heart valves, they either become thickened and resulting into the stenosis of these valves. So when the valve becomes stenotic, the only option that we have right now, which is durable and provides a long-term outcome with a very good results, it is replacing these type of valves. And what type of valves do we use when we are replacing them or repairing them? We have two types of valves that we use in the market. We have the mechanical valves. These are valves which are manufactured in the industry with the metal, with the metals which can be replaced in the human heart, and they can be used in human. And they are of different brands in the market, and they are sold at different prices. And we prefer to use these mitral valves when the patients are very young, because the very young patients, the life of expectancy is very high. So, and that's why we prefer to use the mitral valves. And so, the valves whereby we use the mitral valve is the patients who are less than 50 years. And those patients who are more than 50 years, whereby their valves become stenotic and or leaked and they need to be replaced, the most preference that we use the biological valves. The biological valves, or the way the tissue valves, they are the valves which are manufactured from the products of the other animals, and most of the times they're products from the pigs or the sheep. These valves are not durable for life. They might be also degenerative as our native valves. The durability of these valves is between 10 to 20 years, and they are found in different markets, and they are sold at different prices. And these valves, in later times when they become degenerative, there are other means of using other type of techniques like percutaneous technique to replace these type of valves. The most affected people with these type of diseases are obviously the elder patients who are living longer, and in most cases we find people affected with aortic valve diseases, or the mitral valve diseases. The tricuspid valve disease or pulmonary valve diseases, they are very rare. The pulmonary valve disease is mostly found in patients who have congenital, who had previous congenital operations, or other type of problems that they face during their early periods of their life. How are the heart valve diseases in Africa, and do they vary by regions? Africa is the continent where it is a less developed continent and a developing continent, whereby mostly common disease that we see are rheumatic heart valve diseases. And mostly the patients who are found in Africa, they come across the valve diseases whereby their valves are either stenotic or leaking. But the most thing is due to rheumatic fever they got during their childhood, and they did not use the antibiotics. In most these type of rheumatic heart diseases, we prefer replacing them. Rheumatic heart is a major concern in Africa. How does this disease develop, and can it be prevented? Yeah. So the rheumatic heart valve diseases, it is due to the rheumatic fever, whereby the people affected in the younger age, where if you have the upper respiratory infection, bacteria or viral infection, most of the time is due to bacteria infection. These infections, they have to be treated by using the antibiotics. So when they are not treated using the antibiotics in later times, they affect the valve. And when the patient gets older, they find their valves either being leaking or being stenotic. So these diseases are very preventive. Rheumatic heart valve diseases is very preventive, especially in younger kids who have the upper respiratory bacterial infection. And during this period, they either need to use the antibiotics to treat this infection, so that they cannot get affected to their heart valves. Malnutrition, it does not directly affect the cause of the valve diseases. When a person is not feeding very well, is prone to infection, and one of these infections is the upper respiratory system infection. And as I've said earlier, that this type of infection can result into affecting the heart valve. So when a person is not feeding very well and having a balanced diet, he can suffer quickly from the bacterial infection, especially in the upper respiratory system, resulting into a rheumatic fever, which results into rheumatic heart diseases. So in conclusion, we can definitely say that malnutrition, which is one of the major factors in most of the African countries, especially in kids, it is associated with bacterial infection, especially of the respiratory system, which can result into rheumatic fever and eventually result into rheumatic heart disease. Today, we have tried to talk about the most common valve diseases which are found in African countries, especially the rheumatic heart valve diseases, and how they have affected the nation and how to prevent it. And also, we talked about malnutrition being one of the factors which causes the increase of the rheumatic heart diseases in Africa and how to prevent it. And this is what we have talked today, and I hope to see you next time.